Staying with the topic, South Korea is facing a shortage of protective face masks, but with the U.S. and the WHO advising the general public not to purchase masks, people are confused about whether they need to wear them. Choi Jeong-yoon talked to both international and domestic experts to find the answer.
What's the hardest thing to get hold of in South Korea these days? Protective face masks. Koreans are lining up day and night to get their hands on masks. But due to limited supplies, many are leaving empty-handed.
I've waited here several times but failed to buy masks every time.
However, the U.S. and the World Health Organization say healthy people do not need to wear a mask.
Unless you are ill, you have no need to buy a mask. And to be there for healthcare providers is to not purchase masks on the commercial market.
The South Korean government has also changed its stance on using masks. People are now being told to wear the same mask several times, and the masks made of cotton can also be used. This is different from what the government had previously said. People are confused over the conflicting advice and are asking authorities for a concrete answer on whether masks can protect them. Experts say advice can change.
These are decisions that people make based on the best information that they have available. And, it's always possible to look back or to find reasons why, we should or shouldn't follow them.
Even though masks can't completely stop the wearer from catching the virus, they can help prevent people who are more susceptible to the virus from getting infected.
When a person coughs, masks block droplets containing a virus from getting out. As community transmission has broken out in South Korea, we don't know who's infected. You need to wear a mask because you could be spreading the virus and infecting the elderly or those with underlying health conditions without even knowing.
Masks should first go to those fighting on the front line of the outbreak.
At times like this, masks can be used more than once. If properly disinfected, masks can be used up to 10 times for normal cases. With a limited amount, masks should be given to medical teams treating infected patients.
As coronavirus is not an airborne disease, it's more likely that the virus spreads by people touching their faces after touching objects contaminated by droplets from an infected person. Experts say wearing a mask is a matter of etiquette that protects others from your germs and contains further spread of the virus. The most effective way to protect yourself is to disinfect your hands by washing them with soap and sanitizers. Choi Jeong-yoon, Arirang News.